If the stem cells themselves carry the pathogenic gene, differentiating them doesn't fix the underlying problem.
It's like trying to fix a corrupt computer program by copying the corrupted file onto a new drive. The hardware is new, but the software bug is still there.
That is a perfect analogy. For this trial, they have to isolate the variable of the procedure itself.
And they can't do that if the source material is already, compromised.
Right. Future therapies might involve gene editing before the transplant, but for now, they need the cleanest data set possible. Primary PD, but not genetically inherited PD.
That's a critical distinction. Okay, so we've cleared the biological and genetic checks. Let's move to the practical limits for enrollment, the physical restrictions.
Sure. So the trial sets both a floor and a ceiling here. First, let's talk about disease duration. If you've been diagnosed for less than 5 years, they generally advise against applying.
Less than 5 years. Why that specific wait time? It seems a bit arbitrary.
It's a pragmatic choice, really. It's about optimizing resources. For patients early on, drug treatments, dopamine agonists, and so on are often very effective.
And if the drugs are working, there's no need to jump to a major surgical intervention.
Exactly. This study is targeting patients whose drug therapy is becoming less effective or who have just progressed beyond that initial stage.
So that's the floor. What about the ceiling? I imagine this is pretty demanding physically.
It is, and recovery capacity is crucial. The source material says that while many people, even approaching 80, are inquiring, the upper age limit for admission is strictly 75.
A firm cutoff. I'm assuming that's about physiological reserve.
Absolutely. The whole procedure, from extraction to the brain implantation itself, recovery from cranial surgery just gets a lot more complex, more risky as a patient gets older. 75 is the ceiling they've set for safety.
Okay, so less than 5 years is too early. Over 75 is too late. But there's a fourth major exclusion that really speaks to this need for data purity you mentioned.
Yes, and this is a big one. The patient must not have had prior brain surgery.
Why is that?
The trial strongly prefers applicants who have not previously undergone any cranial surgery, especially things like deep brain stimulation or DBS.
Wow, that must be a pretty significant portion of the advanced PD population. Why turn them away?
Because if a patient has had surgery before, the brain's anatomy is already altered. When the researchers assess the outcome, they have to know that any improvement is solely because of the stem cell transplant.
And if there are already electrodes from a DBS device or scar tissue, it just muddies the water.
It completely complicates the assessment. You can't introduce a new variable into an already altered system if your goal is to prove the new variable works on its own.
It's all about controlled variables.
It is. This trial is laying a foundation. They need a clean slate. And even if you meet all four of these criteria, it doesn't guarantee you're in. There are still comprehensive checks on overall health, organ function, all of it.
That sounds like a long screening process even before the science starts. Which I guess brings us to the timeline itself. Here's where it gets really interesting, because the source describes the cycle as very long.
And that might be an understatement.